come forward and get tested. But in that batch of over 4,000 tests, there were 5 new cases, which again is a good result given what the results we were experiencing a couple of weeks ago in March. I also want to stress to everybody that May will be a bit different for everyone, and I said that at the end of each month I would give an update of what May would look like. Already the government's made clear that we want schools to go back in May. From May 11, schools will be returning, students will be going back to face-to-face teaching. And I do want to stress that we're very hopeful that the first few weeks of school returning will result in us being able to possibly truncate the process, to have full-time student attendance face-to-face quicker than we anticipated. That is our goal, that is our mission. But of course, we wanted to introduce the staged approach to make sure all of our schools are ready for any unforeseen issues that might arise, but also ready in case there is a breakout in a local community and they can respond quickly. But our aim following May 11 is to get schools back to full attendance as soon as we can. It will be staged for the initial fortnight, and then based on those results we'll be able to update the community on how quickly we can have full-time attendance. Again, that will be based on how things go, but we're hopeful that students will be getting full-time face-to-face teaching during and definitely by the end of term 2. I also wanted to stress 2 further things which might make May look a bit different. Secondly, I raised yesterday the prospect of increased retail activity. We've already seen in New South Wales. I suspect because of the low number of cases and also because of the advent of schools going back, some retail outlets have chosen to reopen their doors, and of course they're allowed to do that. We encourage people to buy what they need, to buy what they want, but please make sure that when you're in those shops, when you are shopping, that there's good social distancing, but also that you follow all the hygiene requirements. And of course the retail outlets themselves have to follow those requirements in terms of making sure they have social distancing in their stores. They also have hand sanitizer available, and we want to make sure that both the retailers and customers appreciate what they need to do. So please know that is something the government encourages, but also wants to make sure that everybody sticks to those social distancing rules when you're out and about shopping. The third change in May, which will commence from Friday, is, as you know, we've currently not allowed people to go visit each other in their homes. From May the 1st on Friday, 2 adults will be able to go and visit anybody else in their home on the basis of care, on the basis of reducing socialisation and everybody's mental health. We know that for many people they've been cooped up in their homes for a number of weeks, and with the exception of exercising medical needs or buying what they need to or going to work, many people have been isolated in their homes. So please know that from Friday, 2 adults can go and visit anyone else, and we've said, I've used the word adults to say that obviously if you've got young children it's okay to take them with you, but a maximum of 2 adults will be able to visit anybody else. But I do want to stress that if you're visiting someone who's over 70 years of age or someone with a comorbidity, you have to practice really good social distancing. If you have the mildest sniffle, do not go and visit anybody. If you're feeling slightly unwell or fatigued, please do not risk it. Don't visit anybody. Similarly, if you're over 70, we still recommend you keep leaving the home to a minimum. But if you do feel you need to go and visit someone in their home, please make sure, similarly, you ask questions about making sure everybody is well, making sure that everybody practices good social distancing. So I want to thank the community for really supporting our initiatives during the last month. It's been difficult for many, and please take May as a sign of us doing well, as a sign of New South Wales moving towards easing restrictions, and certainly with the advent of school, increased retail activity, and now people being able to visit each other in their homes to reduce social isolation and improve mental health are 3 key areas which we expect to see increased activity during May. But having said that, whilst we are keeping control of the spread and reducing the spread, we know that the period of isolation and the restrictions have had a devastating impact on jobs and the economy, and please know the priority of our government is to restore those jobs, is to provide that economic stimulus where we can. And I'm very pleased today to be joined by the outstanding Minister for Planning, Rob Stokes, who is ensuring that we expedite the approval process for key projects in New South Wales. He will discuss in detail the first tranche we're looking at. There's 24 projects we have identified that will boost billions into the economy and provide jobs. if they get approved, but obviously by expediting the approval process, it means those jobs, those projects hit the market earlier than they otherwise would, and that is a huge boost for the economy, but also the prospect of more jobs, and that is what we are all about. It's obviously dealing with the health crisis, but also appreciating the devastating impact this has had on people's ability to work, and we're looking to do everything we can to boost jobs and stimulate the economy as well. But overwhelmingly, I just wanted to thank all of our residents for your patience. Please know relief is around the corner. So I guess the biggest change from Friday for most people will be that that 2 adults can go and visit another household. Please do that responsibly. We trust everybody to do it responsibly. We don't want to see the numbers suddenly spike up because people are being irresponsible, and I'm absolutely confident that people will be responsible because there's too much at stake. I anticipate during May we will see more cases, and that's because when you increase activity, when you see people move around more frequently, you will see more cases, but our health system will be able to cope with that because we've used this time during April to build up our capacity, to get the extra PPE, and to make sure that we're ready, whether it's in schools, whether it's people going shopping, or whether it's people now visiting houses, 2 adults at a time. We'll make sure we have those provisions in place. I'll now ask Dr. Chant to give her daily medical report, and then Minister Stokes will outline in greater detail the package that we're announcing today to really boost jobs, bring forward projects, and provide that certainty for people moving forward.
So there's been 5 new cases from over 4,112 people tested in the 24 hours to 8 p.m. on the 27th of April. And I'd just like to thank the community. We did not see the traditional dip in testing over the weekend, but as the Premier indicated, we really want to see very high rates of testing, and we're aiming for around 8,000 tests per day. It is also pleasing that those 5 cases are all linked and known to have a source or linked to a cluster, so hence not community acquired with no link established. So we have a total of 3,009 confirmed cases in New South Wales, and 2,243 people have recovered from their COVID-19 infection, and we'll be continuing to follow up individuals at that 3-week mark and then 2 weeks after to continue to update those recovery data. There has been 1 new death in the reporting period, which brings our total deaths to 37. There are currently 142 COVID-19 cases being treated by New South Wales Health, and this includes 19 people being treated in intensive care units, with 15 of these requiring ventilators. And over 3/4 of the cases that are being managed outside the hospital setting, either in hospital in the home or in hospital hotels. There has been 1 new death related to the Newmarch House, an 89-year-old female resident of the Anglicare Newmarch House, and this brings the total number of deaths linked to this facility to 7. And there has also been 1 new case in a staff member at Newmarch House, which brings the total to 54 cases, including 20 staff and 34 residents. There have been no new cases related to the Boddington Aged Care Facility in Wentworth Falls. Thank you.